Over the last 2 days, the daily COVID caseload breached 1,000. It was back on the 26th of September last year that the country saw new cases of such volume. But back then, the daily cases were on the way down, owing to quarantine curfews and other restrictions put in place. Meanwhile, studies conducted by the University of Sri Lanka have led to the conclusion that the COVID variant Omicron is responsible for a lion's share of new cases found in the island. With many Omicron patients being either asymptomatic or showing just mild symptoms, tracing the source of infection is also proving to be difficult. Now the question being asked is if there is community transmission. The expert view is, seeking a definition on the present situation is futile.
I think scientifically it is extremely difficult to prove that the community transmission itself, because the cluster transmission cannot be established due to the large number of people who are having mild or asymptomatic are there, and there's a possibility of proportion of such persons in the community, and as a result it is extremely difficult to, unlike previous days, to link each and every new case to a previous case. So therefore it is scientifically not possible to exclude the cluster transmission. However, we know that large number of cases are emerging from the community, and rather than arguing on whether the community transmission is there or not, what is important is to adhere to the health guidelines and make sure that you are not contributing to the spread of the disease.
Meanwhile, the Public Health Inspectors Union says that COVID cases within schools as well as among expectant mothers are on the rise. In the meantime, a study conducted by researchers affiliated with the Pasteur US-based scientific platform suggests that some people infected with SARS-CoV-2 may be able to transmit the virus for longer than the recommended quarantine period. The study involved 38 Brazilian patients who were followed on a weekly basis between April and November in 2020. According to the researchers, 2 men and a woman of the 38 cases tracked were atypical in their sense that the virus was continuously detected in them for more than 70 days. Based on their results, they say that about 8% of people infected by SARS-CoV-2 may be able to transmit the virus for more than 2 months without necessarily manifesting any symptoms during the final stage of the infection. Further, they say that there were patients who remained positive for 71 to 232 days. On the vaccination front, a considerable public turnout was seen today at the vaccination centre operated by the Sri Lanka Army in the Derana, which offered the booster dose. Further, mobile vaccinations conducted by the Tri-Forces was worked off in 15 districts today in a bid to increase the booster recipients. By last evening, the number of people who had obtained the booster dose stood at 5,261,005.
Now the reports have very clearly indicated that those who got infected and finally ended up in complications and ICU care and oxygen demand, majority are still those who have not got any vaccination, or those who have failed to get their booster vaccination are the people who are really getting into this category. So therefore it is extremely important to get the booster vaccine as early as possible.